As we first told you last night, Maine's Health and Human Services Commissioner Jean Lambrou faced some tough questions from the legislature's Government Oversight Committee about severe shortcomings in Maine's child protective services.
The hearings were prompted by the deaths of 4 children in the system who all died within weeks of each other, all at the hands of an adult. Now, child advocates in Maine are asking exactly what plan does DHHS have to fix those problems. And as News Center Maine's Caroline LaCour reports, those are the same questions members of the committee want answered as well.
I also share your frustration.
An acknowledgement Wednesday from Maine's Commissioner of Health and Human Services about serious shortcomings within the Office of Child and Family Services.
Performance on some key child welfare metrics has worsened. Staff vacancy rates have risen, and it is important to acknowledge that.
Joined by actor-director Bobby Johnson, Lambrou testified before the Government Oversight Committee. Some of its members clearly impatient with a lack of movement in addressing staffing levels, support services for caseworkers, among others.
We can't just keep saying, here's the new initiative, just wait, things are going to turn around.
Each one of those kids I know should be living today, but
also finding his patients being tested is former state senator Bill Diamond.
Because they've been saying, now we'll do something. I've been listening to them for 5 years, and it's time we stopped accepting that as an answer.
He founded the nonprofit Walk a Mile in Their Shoes, an organization that worked closely with families to prevent the abuse of children under the state of Maine's care.
So if they're going to make some changes, they have to change the culture. Simply changing people, as I say, won't help. But that culture change would have to be a more willingness to listen.
By listening closer to caseworkers and the families affected, Diamond believes the department could better identify risky situations rather than wait for change through a new director, as mentioned in Wednesday's opening statements.
Changes, while good, are not keeping pace with persistent problems as well as new challenges facing Maine families.
The gap between that and those families needed and the support they got was wide enough to begin with. The pandemic and the struggles families went through only made it wider.
Families are more stressed, they're experiencing more challenges, and they have less access to the supports and services that they need to get the help they need when they need it.
Melissa Hackett of the Maine Children's Alliance says by using future funding in a smart way, those needs could be addressed for both staff looking for support as well as the families they serve.
So having specific staff members to focus on certain parts of the system where caseworkers said, I really need more help with this so I can feel like I can do my job well.
In Portland, Caroline LaCour, News Center Maine.
We also reached out to the spokesperson for DHHS on whether it has an action plan. DHHS did not get back to us by our deadline.